Okay, let's go through some data and then just want to kind of give a state of where we are with this. Is there's increased pressure throughout New York related to cases. Unfortunately, we've lost 2 residents over the last 24 hours related to COVID. 2 females, one in her 70s, one in her 20s, both with underlying conditions. We've lost 66 residents since October 1st, and 69% of those residents were unvaccinated. There's 84% of 18 and above in this county have been vaccinated, so 16% is making up 69% of the deaths. Certainly the vaccine continues to help those who get very sick do better than those who are unvaccinated. Hospitalizations, 115 are in the hospital right now, 24 are in the ICU. 79% of those in the ICU are unvaccinated. Again, glaring numbers when 16% are driving between 79 and it's as high as 90 most days of our ICU stays. Certainly another key indicator. We now have 1,294 active cases. We have 271 cases today. 23% are household contacts. To give perspective where we are, we're not, when you look at other parts of New York, it's hard to compare us to New York City or to Long Island, even the Hudson Valley. So looking at the thruway communities is probably the best. So Onondaga County, collectively speaking, we're actually in better shape than our thruway community partners. 42.2 cases per 100,000 people. Albany County, 45.9 cases per 100,000 people. Oneida County, 59.5 cases per 100,000 people. Monroe County, 56.6 cases per 100,000 people. In Erie, 57.5 cases per 100,000 people. Western New York's having a hard time right now. Yesterday, all the county executives were on a call together going through what we're seeing. It's my belief that probably about 8 weeks ago when we were having a spike in Central, relatively speaking, that's what they're seeing now in Western New York. But overall, there's pressure across the board as Halloween hit. People have started to go indoors. It's not quite what we saw last year, but that's probably because we have 320,000 plus people vaccinated, where last year we didn't. Related to boosters, yesterday we gave our guidance that anyone who feels at risk, 18 and above, 6 months out with the Pfizer and Moderna vaccine, or 2 months with the Johnson & Johnson, can get a booster. We'll have a booster clinic here at the Civic Center on Tuesday from 9 to 4. You can go to ongov.net to register. You can also continue to go to your pharmacies and some doctor's offices as well, and at the fairgrounds as well. They're giving out booster shots as well. Some data on our 5 to 11-year-olds. We have had 2,900 5 to 11-year-olds receive their first vaccine dose. This has been a collective effort with pediatricians, our clinics and schools, pharmacies, and here at the Civic Center. We're not quite at 10% yet of that demographic, but we continue to have more and more clinics. In partnership with Wegmans and Kinney Drugs, next week Lafayette and OCS has a clinic November 19th, November 22nd, Baldwinsville, November 23rd, Clary School, November 29th, Liverpool, December 7th, Montessori School, and then the week after Thanksgiving, second doses are starting to be given as well. December 16th, actually, Solvay as well. So we encourage families to take advantage of these clinics, these school-based clinics, and register. We're going right to you. In addition to that, I do want to highlight the fact that people are going to get sick with COVID. So what do we do when we get sick? And we do have therapeutics now that we didn't have before, specifically the monoclonal antibodies. It's proven to reduce symptoms related to COVID and help keep people out of the hospital. So who should go if they get COVID to talk about getting these antibodies? In general, anyone over 65 with underlying conditions, anyone under 65 who may have obesity, pregnancy, kidney disease, diabetes, suppressed immune systems, lung disease, or cardiovascular disease, sickle cell disease. So what you do is you don't go to the emergency room. You can call 315-464-5955 to be screened, or you can call your doctor, but you really need to call right when you get your positive test. Waiting 2 or 3 days isn't going to work. If you do this right when you get that positive test, if you fall into these categories, please, please, please reach out so you can get this therapeutic. And looking at what we see happening now, we need people to really assess why you haven't been vaccinated at this point, and you really need to get the shot. We really need people to get out and get their booster shots. So in addition to that, in our cluster reports show workplace spread. So we really need people, when you have any symptoms, even light symptoms, because you've been vaccinated, there's a high probability that you have COVID. And you go into work, and then it spreads. And you have 8, 9, 10 of your colleagues who are out of work. So we really need employers to look at their own policies within their buildings related to masking and physical distancing. But we need people to stay home when you're sick and get a test. That's where we were for a long period of time now. We're going to have cases, at least in the range where we are today, moving forward. The way that we can nip this and keep things at the levels where we are, maybe get a little bit better, is we need people, when you're sick, to stay home, get a COVID test. And in addition to that, the guidance we've been giving out specifically with indoor venues with lots of people, people really need to, if you're going to the grocery store, put a mask on. And these are things that people really need to consider, especially in the settings where regular folks need to go and could be immune compromised. People need to go to the grocery store. Be respectful, put a mask on, and so that we can try to make those types of environments as safe as possible. But we know what works here. We need to really focus in, use the tools we have. There's more therapeutics coming out with Pfizer. Short order, they went for their FDA emergency use for the pill that's supposed to help us really avoid hospitalizations. So there's more tools in the toolbox that we'll have soon. But the tools that we have now is the vaccine, is the booster, is the monoclonal antibodies, and is some common sense. When we're sick, you stay home and you get a test. Happy to take questions.
I'm sure you heard the news, or you knew before we all were reporting it, that Upstate has 400 openings for nurses that they haven't been able to fill, and they've had to reduce their patient bed capacity by 20%. Is that an emergency to you? Is that concerning to you?
It is. I think overall, you have, and this is the biggest challenge, right? The cases, are the cases, but it's always about your ability to treat your sick, not just related to COVID, but from a macro level. When you're canceling elective surgeries, these aren't, as I told the group earlier today, these aren't vanity surgeries, right? We're not talking about plastic surgery. We're talking about somebody needs a new hip, and they can't get a new hip. So the system is stressed tremendously. The mandates probably, even though the impact wasn't as large, which is good, but any impact when you're talking about a stress system is not good. But you have problems now, right? So you have long-term care facilities aren't really taking in a lot of new patients, and so then you'll have increased hospital stays potentially, and the discharges don't happen as much. And we really count on that flow a lot when sick people come in to get the people that get better out quickly. And so overall, it's a concern. Even on our own team, we've lost nurses here, quite a few. Some of them have gone to the hospitals here locally, so we still have them in the community, but we've lost some to traveling nurses and whatnot, which makes it harder to do the things we want to do as well. So staffing's a huge issue for everybody right now, and that's why we watch what's going on in the hospitals as closely as we do.
What can county government do to help the hospitals?
The county government can't really do much. We don't have workers we can give. The community can do some things, and the community collectively can help by doing the things that we're suggesting we can do. We have 71.5% of our population has been vaccinated. That number is going to slowly get higher as more and more 5 to 11-year-olds. But 5 to 11-year-olds aren't really driving hospital numbers. They're driving case numbers, but not hospital numbers. And so the unvaccinated, and I'm not trying to be a bully, but the data shows what's happening. The majority of your hospitalizations are unvaccinated. The supermajority of your deaths are unvaccinated, and the super majority of your ICUs are unvaccinated. So that's the tool. Please reassess why we haven't used the tool, and let's get there. At the same time, to avoid the antibody treatments will help as well avoid hospitalizations. This is an appointment. You go in, you get infused with these antibodies. It doesn't take long, and then that will help us avoid hospital numbers as well, which will alleviate stress on the hospitals.
The governor has touted her new program with SUNY and CUNY to offer the scholarships for nursing students. That's a good step for future, but it doesn't help in the short term right now when there are 400 positions to fill just in upstate alone. I know the county is in a position where they can't do a lot, as you've already kind of outlined, but when does the National Guard that the governor has said is at the ready, when is it an emergency enough for them to come in and help?
Yeah, I think I would leave that request to the hospitals themselves. They would know their operation more and where that type of help could get plugged in. We have conversations all the time with Dr. Dewan and Dr. Corona, and they know when they were having issues with being able to pay their people, they came to me, and we were making calls and having conversations, and when they had to get approval to pay more so that they could get people to come in and work the overtime. Certainly, in our conversations, I will advocate fiercely for any partners if they believe that they have a role for that type of help. I do know the National Guard, I believe, is vaccinating boosters right now out at the fairgrounds, so we do appreciate that they're back in the community giving us the helping hands that we need for these booster shots to help us provide that extra immunity to try to get through these winter months.
You've been cautious about mandates. Are you considering mandates for any category moving forward?
Yeah, we'll never take anything off the table. It's just you have to look at and again, we had this call yesterday with our county executives. You have Erie County and Monroe are in a tough spot right now, and we talked about what the data shows and what mandates could help drive this. The challenge being you're one county, but you don't, there's not walls around your county. If you don't work regionally with the same policies, then you're going to, especially if you're a hub community like us and then Monroe County and Erie County, you know, you could be impacted by your bedroom communities surrounding you. So there's not, some of the mandates that were here in the beginning of the pandemic, there isn't one county or one community in the state doing it. And there's various reasons for that. And part of it is the game has changed a little bit. This is, Delta is different, and 100% of our cases are Delta. So we're all communicating, sharing best practices. We've all agreed that the best messaging is you got to get vaccinated. You got to go get your booster. That's why I did what I did. You know, you need to stay at home when you're sick. We will increase asymptomatic testing going into Thanksgiving for sure. So that's something that we will be doing a lot more of, more rapid testing going in. It's not practical to think people aren't going to go be with relatives during Thanksgiving. And then people need to be a little bit more courteous with some mask wearing and some of the venues where people have to go. You have to go to the grocery store to get food, right? You don't have to go to a restaurant. You don't have to do those things, right? So there's choice involved with that. So certainly, Andrew, we're looking at things. We'll, you know, I've looked at large events, vax test or mask type guidance that we may do. Certainly, if we get evidence that that's driving cases, we'll take a look at that. But right now, when we get our cluster report, a lot of it is workplace spread. It's a lot of it. We still get about 20% of the 0 to 11-year-olds, you know, and so you know there's some things we can do to tighten up there to help avoid some of this.
Is there an opening to do more with vaccine requirements in order to entice people who are still on the fence to finally push and get one, whether it's restaurants? I mean, New York City's doing it with restaurants. That is a community in our state doing a mandate like that. Just wondering if the discussions have happened and where you fall.
Yeah, we haven't talked about that, and we haven't really seen in our cluster reports restaurants being one of them. So with New York City, people need to remember what they've been through, right? So the communities with the lowest positive rates are the communities that got absolutely hit the hardest, and then everybody wanted to get vaccinated. And they're the communities with the highest natural immunity as well. So you have the most cases in New York City, got hit the hardest, people want to get vaccinated, you have the most natural immunity. Your second, Long Island, same thing. Then Hudson Valley, Westchester, same thing. So our community, because we had 2 to 3 weeks essentially to mitigate before we had cases, we never got hit hard in the first wave, right? The first wave was all about the unknown and managing community-based shutdowns, not knowing how to manage this virus, building up the infrastructure to respond to the virus, and then reopening an economy. Our highest case day was 60 cases, right? So they went through hell. And so the motivation from the body politic and the community was very high and much higher than ours. You know, we're higher than Erie and Monroe. That's probably why when the throughway Delta wave came through, we didn't get hit the way that they're hitting now because our vaccination rates are higher. But certainly there's a segment of the community that we need vaccinated. The problem when you mandate some of these things, especially from an employer-based thing, you run into what Mary was suggesting with the health care. If I mandate these things, I might not have people watching the jails, okay? I might not have cops on the street. You know, people have choices because not everybody's doing it. So there's real operational consequences to mandates. And if every entity in the state or the country isn't doing it, then it's you put yourself in a real risk point to be able to have your continuity of operations for government.
Well, let me ask more broadly then, what new tools could you employ to get unvaccinated people vaccinated? You've done the incentives, you've made it relatively easy. Everyone's found a vaccine who wanted one. What's left to do?
We're going to need to message better, and unfortunately, I think some people are going to learn life lessons, and that will turn things through. And if you talk to the doctors, they hear it all the time. Somebody in the hospital saying, "I wish I got my shot," but it's a little too late at that point. So we're going to look at things. We're going to look at best practices from other communities. But you're talking about a contagious respiratory virus. We have tools. We know what works. People need to kind of get through the fatigue and just get focused a little bit more. Be a little bit smarter with your gatherings. If people are if people have any symptoms, they probably shouldn't be coming to your home. Thanksgiving, I said, we're going to really boost up our testing for people to be able to come and take advantage of that. But we just need to get re-engaged mentally a little bit better at this point, moving forward, so that we can keep things in a sustainable area. We're not getting to zero, probably again in our lifetime, but we need to be able to keep this in a sustained area and collectively work where the pandemic ends and it becomes an endemic.
You know, after the masks went away for those few weeks, and then the recommendations to put them back on came, not everyone converted back. There's still many people in grocery stores not wearing masks. Are you ready to say it is unacceptable to not be wearing a mask in the grocery store?
Yeah, you should wear a mask in the grocery store. And we look at our guidance has been very clear related to indoor venues with mask wearing this whole time. But just from a practical standpoint, people have to go there. They have to. You should do that. That's one area we would look at a potential mandate, because it's an area, if the industry felt they could enforce it, I'd be willing to look at.
You said you are planning to increase asymptomatic testing availability. When will we see that rolled out and where people can get it? And do you suggest that if people are fully vaccinated before Thanksgiving, that they should be the ones who are going to get those tests before they go see family? Or?
Yeah, I think it's smart that people check their symptoms, and then even in addition to that, if you have the ability to get a test, to get it. We're going to try to get it done next week, Mary. We got to build up that, and we'll get that information out. But that's something that we talked about on our call yesterday as well, is an area where the state can help us. Potentially, we have the ability to procure these kits ourselves, but all counties don't all have the same bank accounts. So statewide, to get thousands of these free tests out so people can, have that option in every community would be helpful, because we are so mobile.
Do you have the funds right now in the county?
Yeah, and we have some of the tests too. So we'll get those out, and we'll get we have them twice a week still right now, but we'll increase that, and we'll increase the hours as well.
Are you working closely with, I'm assuming, Dr. Gupta on that as well? Has she shared any other guidance that she wants to have you share with the community as we go into the first of the holiday weekend?
Yeah. I think the people need to, gatherings there's risk, right? But there's the medical experts, right, who will say maybe don't have gatherings. Then there's people in my role who have to look at the practicality, and I know people are going to. So if you're going to, and I am likely to as well, let's take some of the risk out of it. If you're sick, any symptoms, you probably need to get you need to get a test, period. But even if you're not, and you're going to be with loved ones who have underlying conditions or fit the demographics that this virus has been brutal on, be smart, get a test, make sure that you're not the person, an asymptomatic carrier, and then you've done what you can do. And I think that's the practicality of it. Some people may decide not to get together. That's physical distancing, we know works, but thousands and thousands of families will get together, and we know that's going to happen.
Have the hospitals expressed a crisis beyond elective surgeries, a crisis in terms of emergencies, COVID cases? I'm wondering we use the word hospital capacity, and it seems like because of the flexibility of hospitals, we've never in this community gotten to a crisis. I'm just wondering where that stands now, knowing what Upstate has released today.
Yeah, so last year we were very close in January and February with real problems. We had over 300 COVID-related patients. Today we have 115. So even though you're a third of that number, what has changed is the staffing at one of the hospitals, right? Krause and Joe's has staffing challenges as well, but not what Upstate's seeing. So that brings your ability to treat increased COVID pressure. We've had a violent period of time in our community as well. So if you're a trauma hospital, like Upstate is, who's taking in people from all over upstate New York, that creates more pressure, right? And so they do so many different things. That's why they're typically the first that has to slow down elective surgeries. And the hospitals work so well together now. That's one of the nice things about this pandemic is how well they've worked together to make sure nobody gets in really deep trouble. But we're in month, 21? Are we month 21 of this? It's a challenge on every institution, especially when you have people who've been on the front lines going to work every day, dealing with the trauma that they've been dealing with. So it's a different type of challenge, Andrew. Nobody's going to fold or quit, but we need to recognize this and recognize what the data has shown us so that we can try to do better as a community.